One of the leading causes of concussion is ladies soccer. And so in all athletics, we have the potential of getting a concussion. Now, concussions are usually when there's rotational contact. So somebody's hit on the side and they push the head aside very, very fast. It's the rotational part that seems to cause problem. The brain is under the skull and it's bathed in fluid, cerebral spinal fluid, and that protects the brain. It keeps it from being damaged or some blow for causing problems. But blows such as sudden movement of the head, automobile accident, getting hit on the head, bicycle accident. Now, what are the symptoms? Headache's the most common, dizziness, just can't think good, shake your head, not making good decisions, don't react well. Those are symptoms of a concussion that we have. Some people will have retrograde amnesia. They'll actually lose their memory for 6 to 8 hours before they had the contact. Some people lose consciousness. You can have a concussion without losing consciousness. Now, we know from looking at autopsies of people that have had repeated concussions that there can be damage that's done to the brain. Usually for a period of 7 to 10 days after a concussion, we tell people they shouldn't be reading, thinking, going to school, doing mental activity or physical activity for 7 to 10 days. We have to let the brain readjust. What's happened inside the brain? The cells, we call them axons, when they're stretched, there gets to be some fluid. Potassium actually comes out of those cells and they begin to lose their ability to function well. So we have to give the brain time to rest. If a 15-year-old has a concussion, should they be allowed to continue to play football or that contact sport? Well, that's a decision that the doctor has to make. I think if a child has a concussion, then they need to work that out with their doctor and with a neurologist and make sure that the central nervous system function is back to normal before they go back again. Too often, I think we try and throw it to the side and people will have repeated concussions. Once you have one, it's easier to get the next one, it seems to be. Be very, very careful. If you've had a concussion, think about the rest of your life.